Adolescents and Young Adults with Cancer, or AYAs, have been recently recognised as a group in urgent need of attention. AYAs are diagnosed with cancer in greater numbers than our younger children, and yet they experience poorer survival outcomes, higher rates of treatment non-adherence, and a poorer quality of life, even years after being successfully cured of cancer. A cancer diagnosis in the AYA years also collides with an already complex life stage, and it's a time of psychological vulnerability. With all these complexities, it is crucial that research continues to focus on better ways to assess and manage young people's distress throughout the cancer experience. Unfortunately, there are a number of barriers to gold standard psychological research in this group. One of these is the lack of agreed upon measures of psychological outcomes that have been validated for use in this age group. Such standardized, validated outcome measures are crucial for the field as a whole to advance in our understanding of both the nature and severity of distress that young people with cancer experience. In addition, our ability to create effective psychological interventions depends so much on our ability to first assess their distress. To fill this gap, myself and a team of colleagues from the Kids Cancer Centre at Sydney Children's Hospital, Canteen Australia, and the University of New South Wales conducted a systematic review of psychological outcome measures that have been validated for use among adolescents and young adults with cancer. We searched the literature from the past 30 years, looking not only at measures of distress, but also of more adaptive outcomes such as resilience, benefit finding, and mindfulness-based skills. Interestingly, from over 400 published papers, we were only able to identify 7 outcome measures that had been validated for use among AYAs with cancer. We located 20 more measures that show promise to be used among AYAs with cancer in the future. In addition, the mix of measures that we did find was not especially well balanced. Most of these measured quality of life. At the same time, we found no validated measures for AYAs that assess depression, anxiety, posttraumatic stress, fear of cancer recurrence, sense of identity, or mindfulness-based skills. So, what does this mean in practice? The lack of agreed upon, validated measures of psychological outcomes means that currently researchers are measuring and defining distress and adjustment in very different ways. This makes it difficult for the field to achieve a consensus on questions like, what are the unique needs of young people with cancer? What types of distress are most prevalent? And are our current support and intervention strategies actually making a difference? For the clinician working with young people with cancer on a day-to-day basis, this may mean that certain age-specific facets of distress or adjustment are just not picked up by the scales that are currently available. In our review, we explored a number of important future directions for the field of AYA psycho-oncology as a whole. If you are a researcher, a clinician, or anyone else with an interest in the psychological outcomes of young people with cancer, we invite you to read this review and be part of this important conversation.